Hello, Dr. Zheng.
So dementia is a very heavy social burden for the family and our country. And the patient itself, they don't suffer, but the family member will suffer because they don't have memory, and then later they become even violent. So to prevent dementia from happening to the early age, like 80, that would be a very important things to talk about. So you are 82?
82.
Yes, and you still drive
Right.
200 miles or?
Well, I drive wherever I need to go.
Yes, and you never have even the ticket, right? You're a good driver.
I'm a good driver.
You have a good memory because you sleep well. But also the other thing I want to talk about is intense exercise. So my mother had a dementia, so I don't want to do that. And then I exercise. I used to run. I couldn't run, but now I go swimming. How about you?
Yeah, I swim, and maybe in the evening, or if it's raining, I have an exercise bike. I can't get it up to top speed, but I can get it up to enough that I am doing a cardio exercise. I also do, we have an exercise room where I live, and I do a stepper. So I find the stepper I use for strengthening the legs, and the exercise bike I use for cardio exercise.
Yes, that's very important to speed up the whole circulation so that you get more nutrients, more oxygen. And oxygen is very, very important. So if you go to swimming in the ocean, that's the best because oxygen itself dilates the blood vessel. And then combining swimming and high oxygen in the ocean, then the brain cells will get more nutrients, more oxygen, and not only that, it makes the nervous system calm down. And when the nervous system is calming down, the immune system is balanced, and that way your immune system is not hyperactive to lead to chronic inflammation. Everything is related with chronic inflammation. So if the brain cells has inflammation, then it will degenerate faster. If the joint has inflammation, then wear and tear cannot be repaired.
Okay, if I did, let's say, a brisk walk compared to a treadmill, what will increase cardio best?
I think you are going to calculate your heart rate. If it's 20%, 30%, that's one thing. Just calculate heart rate and see which bring up your heart rate. Mm-hmm. And also, the other thing is you have to judge which is less impact for your joint, for your knee, for your hip, and for your lower back. So that's the two things we need to compare. But usually if you increase your heart rate, let's say by 30%, but I don't know, if you have pacemaker, can you increase?
I can increase, yeah.
How much percentage?
Well, the pacemaker just prevents it from going lower than 70 beats per minute.
Ah.
But my normal, during activity is 80, 85, so I can bring the heart rate up. On the walking versus a treadmill will probably be less dangerous because at my age or seniors, even older than me or younger than me, it can be dangerous. You could have a slip and fall if you're walking on an area that is bumpy or you're not familiar with, and therefore you're having another injury trying to bring your heart rate up.
Yes, but you have to be careful because treadmill is kind of hard for the knee. Some people kind of complaining after that, the knee pain. You just have to judge if you have more pain. If you have more pain, that means it's too much pressure on the joint. So let me ask you, with the pacemaker, how high your heart rate can go? Because the reason I ask this, I have many people, they have high heart rate, right? The heart rate will go up to 120, 130, and that's their reason to get pacemaker. But for you, you go too slow. So what is the heart rate when you exercise? You can reach not interrupt your whole heart function.
I have not found any restriction. The only thing that, my heart is healthy. It's just a little slow, and the pacemaker prevents it from going a lot slow. Before I had the pacemaker, at night, my heart rate would go down as low as 30 or maybe 40, which is dangerous because the heart muscle is really not increasing. So that was the reason for the pacemaker to be installed. But I've done many activities. I don't always check my heart rate, but as far as I know, there's no restriction. It will go as high as my body will cause it to go.
So next time when you ask, when you go to cardiologist, maybe ask them, what is the safest range for your heart rate? I know it will not go too low, but what is the highest level you can go and not interfere with your heart function? I think that's a very reasonable question.
So to know the maximum rate of the heart rate
where you can reach.
Where I'm doing cardio, but I'm not in any danger.
Yeah, like for instance, if you went up to 120, I think that's not very safe for your age. For me, my heart rate is very low sometimes, like in the evening it'll drop to 49, 48, but it never faint. I just feel tired and then I'll go to sleep. Then my heart rate will bring up. So I never need a pacemaker. But I know even I exercise, I increase my heart rate 100%, it only be 100. Mm-hmm. If it's 200, then from 50 to 200, that's a little too much. But so you need a safety range, and so that's the question. Next time you can ask a cardiologist.
Okay, I will do that.
Thank you.